This is a baby cup full of, I'm going to turn the camera around so you can see inside it. This is, it's called wheatgrass because the NH water. Then they failed me then. Home visit, May 2018, last year. Before the infection got that bad, all of my letters went out prior to all this, but chairman's changed around. They're still based in Kettering in Northamptonshire, UK. There's to have a communal-based area clinic in my area up the road. You know, IB to be knocked out in my wheelchair. And suddenly, a female called Deborah, she's still in her job. She heads the service. She's a civil servant in an NHS role. And gosh, I've got a letter here going back to, they call it 18th of 10th, 2012. Gosh, how many years ago was that? Well, anyway, been learning about in statute law complaint system then to get nowhere. I've seen a video of someone's experience in the UK, a young girl, horrendous experience with maxillofacial. So, I'll try to move on. Last year, I didn't know after home visit they refer you to an online. I'm not even in Leeds. Referrals.org. It's to prevent unlawfully the choice of public to choose whatever it may be. There's all this national, the community dental clinic I can't get to, so it's all about these home visits. It's just going around in circles. A lot of this story, I won't go into that because I'm too. If I had things done right for the whole year past year, things might have been different by now. And at the moment, the snow's not hit, stocking up on things. At least I've got things in, so I don't have to go out my own. I can rest in bed in a minute with another heat pad on my face to try and cope with the pain. Peppermint oil, essential oil underneath my ears to help with the pain and bed rest. So I'm going to show you this. I've looked him up online. Oral surgery, maxillofacial surgery, a consultation. I can't even get there myself. And last year, the pets of my mum dying and stuff, struggled as well. But the letters went off to cancel the offer, so somebody else can take the offer up in my place for the time being, okay? So the date of this letter was sent 2nd of the 8th, 2018, Thursday, with an email. They don't use an email back. They're negligent. What the hell is, they use IT systems, so I can't use email for people to get back to. And it's very hard to talk, so bear with me. As I thought, the company house number for the local area adult health social care put down, and since the first, my videos go back to the 1st of the 8th, 2018, you'll see what happened to the national press in my area. And they class people in my situation vulnerable, and this is how they leave me. It's nothing new. I'm emotional because I'm in pain, so excuse me. So I've got it in front of me. This was resent again 3 times, and they claim they didn't get this in their clinic in the hospital. So I tried to email the hospital about NHS national choice. Did I get response? No. So they ignored this because the original appointment was on the days just after my mum's funeral. Could anyone cope with that? Anyway, I've got an abscess coming up. So here I go, swishing this round. Actually, I'm drinking it because it's a nice taste. It's something with the wheatgrass powder. It's meant to help the body naturally. And I need all the help I can get right now. The tissue's all swollen underneath. It needs it all operated on. And it's a risk. Self-caring at the moment, you see, with this is very difficult. Dear. So I'm going to call up a couple of hours if I'm no better as an emergency basis. I'm frustrated because I tried to reach out in the statutory services for so long, and thousands of others like me in the United Kingdom has done the same. And we're getting flogged off, and I don't know how people can cope when you're being paid. Now, when you get an abscess, an infection, it goes through your whole body. You can't, I'm in my wheelchair at the moment, so I can't sit up for more than 20, 30 minutes at the moment. It's not the end of the world. Painkillers, paracetamol, peppermint oil, bananas mashed up with yogurt is my diet. It's not a diet, but it's the only thing I can eat to set my stomach. You need to keep and try and eat. And hot peppermint herbal teas is great to help the cells in the body to keep pain. The pain is nerves, and the nerves are inflamed. Sea salt mouthwashes. At the moment, I've got special drops. I've had to pay the natural health shop. Bloody £15. So all of my cash has gone on stocking up food, thinking it's snowing. It might still hit the area. I hope and pray it doesn't, but all those are my hearts and prayers for all those affected around the world and the United Kingdom, a similar position. Because I only know what it's too like. Anyway, and all those affected by illnesses and disabilities and things, my prayers are with you too. So, it's not for everybody, what I'm saying. The golden seal and echinacea drops. You have to be very careful, and it cure the pain, but they say put sometimes clove, crushed up garlic on it. I don't do pain very well, So I've got a eyelid crusher, so I haven't done that yet. But putting a bit of the peppermint oil right underneath where the abscess is, an infection underneath my chin, and just behind the ears and the back of your neck really does work. And it's complicated, this situation, because when you have physical disabilities, limited self-care, that causes an added problem when you need to access hospital services in the UK. Because the cutbacks, there isn't the staff, you see. Just go on any alternative information. Other people can tell you the same. I'm reading their experiences. It's happening all over the place. That's why I'm trying this natural angle. Again, gotta keep drinking this stuff. Is not ideal. But the point is, I've done everything I can in a very difficult time to source out. I didn't even know I was going to get referred online to dental. I've got to try and show you this without showing my identification, ID stuff. So, I don't even know where it is now. The website, there you go. If I can zoom in, can you see that website? Go and search that, because I didn't know nothing about that company. I don't live in Leeds. So that's when the home visit, because that's when the problem they had with the transport to get me to and from the hospital in the community. NHS England funds my area commission group, CCG, to fund the transport. Private company never turned up from that year. So to rebook it all. And I'm still left like this. It's nothing against a female called Jenny. She meant well. She really means well. And they now don't want me to go to their clinic because of my reduction in my adult health social care situation. So yeah, I need the operation. So I can't get it, can I? Anyway, what on earth? Just anyone go on company's house or find out who owns their name, which my mate's done. Let me just see if I can just get it up and show you myself, actually. My mate's... Oh yeah, and I alerted my mate in America about a photo of my mum. It's going to search this, and a company of this other phone that plays up, and it's called Dental Referrals. And I'll just put in needs. That's what I found out it's from. Not sure it's the right name. Track a referral online. Can your GP referral to a dental hospital? I'm trying to find I've got the website up. So Leeds Dental Institute. So which is this one? Just trying to find out a location for it. Let's go to the website itself for a minute. All right. So they're using NHS digital email location, email server. Their clinical commission team, admin, someone in the commissioning teams in your area, and they charge £2 a minute to ring 808 0845 number. Right, let's have a look. It's a call centre. So I don't know why it's set up, so I'm just looking through. Here we go. Dental Referral Management Centre. This is ironic. So this is who they are. Found it on this website. That's who they are. Dental Referral Management Centre. No idea who they are. So let's dig a bit further. Dental Referral Management System is operated by FDS Consultants. This is really? The clinical team is supported by specialist admins who ensure the process of managing referrals is streamless. All of our clinical so-called employees are registered with the General Dental Council. Yeah, really? Take forever to get a complaint in that one. And undertake regular continuing professional development. All clinical employees are on appropriate General Dental Council specialists. For information, contact the General Dental Council. If you'd like a brochure on our services. So are they a private company? If you're a dental practice management solution provider and would like information on a API, then you can access the document here. What the hell that means, I don't know. This is very head of operations. There we go. Okay. We provide services. Oh, here we go. It is a private company. We provide services to NHS England, hospital and community trusts. Over our services can be used in a full delivery model. Is IT produced? Right. Let me just show you this. I can't even believe this. Right. Looks like a private company. Christopher Albury operations and their emails, if you can use them. And then data officer. I didn't even consent to this at all. We can undertake before waiting list validation. Waiting list 18 weeks breaches if you'd like to know more about. Just doing another research about this company. I didn't consent to this third party having my data. So just trying to find out who they are. Northwest of England they're based. Just trying to find out who the earth this company is. Dental referral management team. It's a computer company. So they do an API v2 referrals. Online. Office dentalreferrals.org. That is what they do. Any other software using dental referrals must provide a way for the user to specify their individual code software. Dental webs. There you go. Dental referral web application. Passing patient data on in the body of the request in response to unique for dental referrals web application. Oh, look at that. Found it. FDS Consultants. It's a private company. They have a user name, a log-on page, an app, save that online, well, on my phone. This is how they do it. So, that is the private limited company using that to privatise, to make profit. And this is all their digital online information that dentists, NHS funded, public funded, are using. That software. Bloody heck. There you go. Bloody heck. And it's instructions how to do this. Let me just see if that comes up as a company information. Right. So, there's a lot of information there. Dental referrals. Gosh. Right, see what we can find. So, company. And what's it called? It's called FDS. Found it. Can't be the same one. Let's go and change. Here we go. I found it. Won't even give me results. Let's try another one. Limited. It's not the right one either. Online or FGS consultants. Right, I found something. I think it's the right one. Let's go back. FDS Consultants, up north, WA13. Online communication structure. So who's paying them? It took months for them to get a referral for me. And they're outsourcing referrals of the public purse. Contract terms. I'm just trying to see what I can find out. Okay, so it does not give any information. Here we are. Oh, here we go. FDS Consultants is not a public authority, therefore does not need to comply with freedom of information requirements. However, for those services that we operate on behalf, here we go, of the NHS, we are required to respond to so they are contracted out. Is a company, thought so. So what is the CCG, Clinical Clinician Group, subcontracting out via NHS England Limited, via nhs.dental Limited, our data, and up to this new company, well, private company, up north in the United Kingdom, without the consent of the individual. I don't consent to my data to go out there since May 2018. That's the new UK Data Protection Statute law, if anyone don't know about that. Yeah, so your people's dental records are held. In my area, it's known as NHS Foundation Trust as well. d.referrals@nhs.net. It's a private company. So here you go. I'm just going to, if it helps anybody else, so that would help me. But that's where they're based. So Warrington is up in Leeds, isn't it? Or where else in United Kingdom? they're using the disguise of the NHS. They're a private company, I knew it. I just knew it. So are they retired individuals? I really don't make sense. Yeah, you have a right to referrals providers in your area. So why have you been referred to these? Who knows? DRSM is managed by a group of dental specialists. No, they're not. Many whom are NHS consultants. Yeah, but how much they've been paid? Oh, look, it says on the website you can choose where you want to be seen. Well, why didn't they inform me then? They never did. They failed to give a choice. Yeah? Dental referral management system, computer system. Here you go. Here's their leaflet. Specialist skills to treat you. An oral surgery. So they segregating out who's be offered what. Complex dental conditions, it will be clear that hospital treatment is the best option and will send a referral directly to hospital. That's what they did to me. But they didn't say about choice. One of their trained consultants review your referral and decide the best place for you to be seen. They don't give you the actual information that you need. Just email. Doesn't give any information about your rights, about NHS choices, and they've got a scan bar there that you can print out certain documents. That's what it is. This is what they don't tell you when you're meant to see your own area. This is a load of so-called private companies. I didn't find this out last year. get an infection. You have to wait. I just don't know anybody else that's actually experienced this. Oh yeah, here we go. I see it in print. They're working with NHS England Limited, so it's private companies. Oh goodness me, what more? There's nothing really for... So you're meant to see service directory, find a provider. This is if you're employed by the public civil servants as a dentist. Find a provider. Enter your postcode and see a map of results in your area. But you can't do that on this website. Let's see what referral forms they used. So that's where the public purse is going, to private companies then, and making us wait for ages. And use an online service for a private limited company. Can't bloody believe this. That's what it says. Accessing referral forms. You need to refer online unless you have approval from your local area. That's NHS Foundation Trust in my area. Yeah, so that means the head office in I just mentioned earlier. So they've changed. They subcontract out. This NHS public funded service is a PAL service, patient liaison service they call it. Don't bloody get back to your emails, by the way. And then you're meant to get a choice of hospitals. Right, who are these bloody people? Excuse us. Yeah. No wonder they didn't get back to emails. My mate sent. Right. They have a dental department in Corby, first floor. Healthcare Centre, Corby. They don't get back to you. This has been going round and round for ages. Yeah, same individual. Nobody mentioned that they changed. It's not just broken teeth, it's all of my teeth now. So, trying to self-care, as I said. It is frustrated when they don't want to get back to you. So, as I said, this letter went to the local hospital, and when my mate tried to phone up a certain individual, they, I don't know how many weeks ago now, they put the phone down, trying to find out, as I said at the beginning of the stream. I wasn't aware that there was this referral and you're meant to have a choice or we're meant to get referred. National NHS Constitution. Yeah, so I knew that one out. Got resent 25th of the 8th, 2018. Yeah. So much for found to be proof of posting. This is back last year, by the way, to re-offer a different time, and in the meantime I don't expect to get another infection, do I? So yeah, public funded services have been deliberately not just see if I can find any information on company information. It's all privatised. Everything is just bloody privatisation. General Dental Council. Again, online. General Register, right. Specialist dental care, specialist care dentistry. Those who have emotional, social empowerment, disability, combination of factors, adults, kids, individuals, groups, society who have physical, yes, that's specialist care, no, or surgery. Treatment, ongoing management of irregularities, something of the jaw and mouth, requires surgical intervention, and this includes speciality, previously called surgery dentistry. And also, it's also so looking at, I would have thought there's a pulp in my gums and my teeth and root that's causing the surrounding tissue. That's the problem for me. I know that. I knew that. The roots. They left the roots in me since 2012 in my area, individuals. And the pulp's infected, that's where you get the infection. And the surrounding tissue, that's where my swelling is in my face. And that's specialist called, and again, the only way if you're going to get seriously unwell is in their bloody system, the hospital. I don't have a normal bite function anymore. And it's not just the oral surgery, it's a combination. Surely I would have thought we have to treat the infection first and work out a plan, a dental specialist plan. And it's not waiting around on this bloody website to get the specialist what you need. Maximum standards, the routes of entry is determined by General Dental Council. Oh, right, okay, so I'll show people the website if you want to look for yourself. And I'm going to go messed up. So they only referred me to surgery. I need a specialist. I need the specialist one as well. I'm going down this one here. This is where my problem is, infection on the lower side of my mouth right now, on my face. Surrounding tissue. I need to deal with that first stream. So anyway, that's the website. God bless, keep safe. I don't know what I'm going to do right now.